Hello, everyone, and welcome to this webinar, Improving Operational Outcomes Through Data Analytics in the Healthcare Industry. My name is Denise, and I'm part of the CCD Health Marketing team. I will be the moderator for today's session. We appreciate you joining us today, and we'll start with our experts shortly. For some housekeeping, if you are having any technical issues viewing the webinar or listening to it, please let us know in the Q&A chat. Most common issues are solved by restarting your Zoom application or refreshing your window if you are in the web-based service. I want to quickly introduce to you our speakers. Will Scott is the Vice President of Business Development for CCD. Will has over 20 years of experience in sales and management within the medical imaging industry. And as the VP of Business Development at CCD Health, he is instrumental in driving revenue growth and establishing strategic partnerships with healthcare and radiology centers. Will you tell us a little bit more about you and what you do for CCD?
Absolutely. Thanks, Denise. So as the VP of Business Development, my job consists of making sure that I'm doing everything that we possibly can to secure the right partnerships in the marketplace, our brand awareness, and making sure that our partners and potential partners understand who we are and what we bring to the table from the standpoint of not only BPO services, but actually KPO services. We consider ourselves a knowledge-based outsourcing firm because we are very in tune and very keen on making sure that we understand your particular business model, how you do things, and becoming a revenue source for you, not just an arbitrage of labor. So we do that by understanding your business model inside and out, and then emulating that business model in our environment. And so, part of my job is to make sure that our clients and our partners understand what we bring to the table as an organization. And I do that with a host of colleagues here at CCD that make the engine go, such as my colleague here, Rafael.
Thank you, Will. Excellent. Today, we're also lucky to have joining us our CCD Health data analyst and business intelligence expert, Rafael Peña-Pelletier. Rafael is an economist and data scientist, super passionate about driving change and innovation. His expertise is in core data science fields such as data visualization, machine learning, data warehousing, and statistical analysis. Rafa, good morning. Welcome. Can you tell us a little bit about you?
Thank you, Denise, and good morning, everyone. Yes, so basically I lead the business intelligence and advanced analytics at CCD, and my role is to, among other things, to provide value to our clients as the thought leaders we are in the healthcare industry, and basically, helping them uncover opportunities, leveraging their data assets the right way, and many other applications of data science.
Well, thank you both. I'm super excited to have you here. We'll start with our topic now, or short, but hopefully interesting agenda for today is this one that you are seeing on your screen. Will walk us through a quick introduction of data analytics and the importance of data decision-making, as well as the benefits and the different types of data in the healthcare industry. After that, we will deep dive with Rafael into what elements you need to become a data-driven healthcare organization and some examples of data analytics in action. At the end of the session, we will have our experts' final thoughts on the subject and 10 to 15 minutes of questions and answers. Speaking of questions and answers, please utilize the Q&A chat box. Rafael and will answer any questions at the end of the session, but feel free to ask any questions as they come to your mind. Also, we wanted to let you know that we will be recording this webinar, and you will receive an email with the link of this recording 48 hours after we conclude this session. So, Will and Rafa, I will handle the conversation over to you. Thank you both for this opportunity to learn a little bit more about data analytics.
Thank you so much, Denise. So one of the things that we want to touch on right out of the gate is what the numbers mean, right? Making data-driven decisions. It's become increasingly important across various sectors, healthcare being one of the biggest. We've estimated that by the year 2028, about $38 billion will be the market size for predictive analytics just in healthcare. We're seeing about a 30% quantity of the data that's created globally is coming from the healthcare industry. And what that means for you as organizations is that it's becoming ever more increasingly important to base your decisions around data. And that's what we mean by data-driven decisions. Looking at the numbers, looking at the information that's coming right out of your organization already. Chances are that if you're utilizing any type of EMR system, risk system, any type of data repository, you're already capturing this data. And it's just about mining it, utilizing it in a proper way to make informed decisions around your organization. A lot of times we do things on our gut feeling, on our hunches, or on our experience in our particular field of expertise. And it's become very, very important in 2023 and beyond to make those decisions based on what the data is actually telling us. We've estimated that about 85% of healthcare organizations believe that data analytics is a priority going into this new phase and new chapter of what we're doing across the market in healthcare. All healthcare organizations are looking at the possibility of turning that corner as it relates to the digital age. And part of that is the data, and the data-driven decision is actually a large part of it. So what do we mean by data-driven decision making? Well, patient care metrics, that's number one. Included in that patient satisfaction and billing process, appointment scheduling, and prompt treatment. Patients are ever more in tune with their healthcare these days. They have so much access to the internet and all of the data that's out there, right, wrong, or indifferent. They still have access to it, which means they're going to ask questions. They want to be informed about what's going on with their healthcare and with their treatment. And part of that is the patient care metrics. So we really push, making sure that those metrics are being captured and utilizing that information to inform the patient base. Big data is another. So when collected, cleaned, and stored, and parsed correctly, very useful for patient satisfaction and outcomes. So utilizing that data in order to, again, inform those patients and then make decisions around patient healthcare along with your patients, and being a catalyst for collaboration with your patients. What we found is that results in better patient satisfaction scores pretty much across the board. Patients want to be informed these days. So we've also come up with what we see as five key benefits for data-driven decision making. One is clinical treatment decisions. Kind of goes back to what I was just saying about collaborating with your patients, making them a part of their care, makes them more comfortable, helps alleviate anxiety around some of the things and the ailments that they may be going through. We also have found that it reduces the disease risk. And this goes back to preventative care, right? Working with your patients to understand not just what ailments they may be having, but what some of the things they're going through might lead to if they continue down the path that they're on, and making decisions around improving some of those lifestyle choices and things of that nature to help prevent disease, right? What's the old saying, an apple a day keeps the doctor away? That's kind of the same concept as utilizing data to make decisions around preventative care, all right? A couple of things that are probably important or should be important to any healthcare organization, because at the end of the day, it is still a business, right? We still have to run that business and make sure that it's not only sustainable, but profitable, right? So improved profitability is one of the things that data and data actionability and actionable insights can help with for any healthcare organization. And part of that improved profitability, obviously, is recovering revenue. We have found that most healthcare organizations have a pretty sizable department as it relates to revenue recovery and some of the revenue that gets lost in the shuffle, whether it be from authorizations or recovering bills that are being paid, revenue cycle management, things of that nature, and recovering that revenue is paramount to the bottom line of making sure that the business is sustainable and can continue to be ran properly. And last but not least, empowering your patients. We have found that most patients, especially nowadays, want to be informed and they want to be empowered about making decisions around their own healthcare. Bringing that information and that power and that bringing that back to the patient's hands, we found that it alleviates a lot of anxiety and it makes the patients more in tune with their particular healthcare. They work with their providers in a more collaborative way, and it just helps the outcomes a lot better. So bringing that data back to the patients has been a huge key in what we found in today's healthcare market. All right. So one of the things that we like to talk about as it relates to that healthcare is bridging that gap between the data and the data-driven decisions. That's a huge key to how we move things forward in the healthcare market. Rafael Pena is one of our highly skilled data scientists and economists here at CCD, and I'm sure he has some thoughts around how we utilize data warehousing and some of these things in order to do that.
Definitely. Thank you, Will. So basically, I've heard data-driven decision making, being data-driven, making better decisions based on data. Actually, quite a few times so far in this webinar. But you might be wondering, what does becoming data-driven really mean, right? So the concept is really straightforward, and I would summarize it as making decisions based on empirical evidence, both empirical evidence and data analysis, rather than intuition or personal biases or perceptions, as people also call them. So since being data-driven requires having access to accurate, reliable, as well as the ability to analyze and interpret data effectively, we would like to talk a little bit about the most important milestones, we may say, or steps towards becoming data-driven. And the first one is data warehousing, and this one is very important. It's actually the first piece of the puzzle here. It is paramount to source, transform, store all of your data in a centralized repository. Not to mention cleaning, parsing, applying business rules, because most of the times you have raw data coming from your information systems, but you cannot really use it straight out of your reports. So all that process of cleaning, parsing, and applying business rules is very important. Then we have our second milestone, which is implementing a data governance strategy. And this one here is also very important, as organizations can establish clear ownership and accountability for data. This is something that typically is lacking in many organizations, but this can help you prevent data misuse, data duplication, alteration, and of course other errors that can impact the data quality after it's being stored, right? Something else important here is the clear definition of KPIs, or key performance indicators, right? Considering they will help you improve your performance. I don't know if you have heard about this, but there is a very important saying in data science and in operations overall, that you cannot improve what you cannot measure. That's why KPIs are very, very important for your business. Then we have the promotion of data literacy throughout your organization. This one is key. And data literacy refers to the ability to, let's say, read, understand, analyze, and communicate data effectively. So it all runs down to continuous learning and training of your workforce. This is why this one here is super important. Then we go to the fourth step, or fourth milestone, which is cybersecurity and frameworks to protect sensitive data. Because right now, or by now, since you started using, storing all these sensitive data points, you're going to have to comply with regulations such as HIPAA, which I'm pretty sure you're familiar with, but also some other data protection regulations such as GDPR and the CPRA, for example, for those of you who operate in California. But bottom line message here in this one is that after you start storing your data, you need to have it secured and with frameworks to protect mainly sensitive data points. So after you have proper data warehousing, data governance, you have trained your workforce and have implemented the right cybersecurity and protection for your data assets, here comes the fun part, right? Which is analyzing your data assets through applied statistics, through machine learning, through data visualization, such as dashboards and reports, either in Excel, Tableau, Power BI, or any other tool out there in the market. But also there are some other analysis techniques. I can just mention real quick a couple of different types of analysis. You have descriptive, diagnostic, prescriptive, and predictive analysis. And if we move to the following slide, we could start talking about some of the things, because the idea here is not to give you a theoretical overview. Of course not. We rather have you live here with inspiration and some ideas based on things we have applied in the healthcare industry. And those applications we're going to talk about have been either developed by us here at CCD or through partnerships with other AI providers out there in the market. And the first one here is an example of, I mean, this one is very interesting, but it is an example of one of the types of analytics that I just mentioned, which is predictive analytics, in which we are basically predicting appointment no-shows. And to give you a little bit of background into this idea, around 7 years ago, we realized that no-shows were one of the most pervasive issues for the healthcare industry, particularly for radiology groups, due to that we could leverage machine learning, and we could use it to develop an algorithm capable of predicting which appointments are more likely to not show up based on a variety of factors. And in here, we used variables such as patient demographics, the imaging modality, where we found that there are certain types of studies, such as diagnostic mammos, for example, where the patients are less likely to become a no-show. Some other things such as weather forecasts, distance to the center, where incredibly we found that the closer you live to the center, the less likely you are to attend to your appointment, even if it may sound counterintuitive. Patient previous behavior, how far out is the appointment in time? So what's the lead time to their appointments? Where the further away in time, the more likely to no-show, and etc. There is a trove of data being generated every day in your operations that can be leveraged to predict or can be leveraged for predictive power in this type of application. And then of course the application mechanism of this use case can be either through targeted confirmation campaigns, in which by having a clean and segmented subset of your patients, you can just trigger those outbound programs to either confirm, reschedule, or cancel the appointment with enough time in advance so that your scheduling team can reutilize those empty time slots. Therefore, you are maximizing machinery and site utilization, which is very important for radiology groups, as I mentioned at the beginning, due to the nature of their capital-intensive operation. And the other application idea would be to, sorry, on the previous one, the other application way would be by strategic scheduling, kind of the airline model, similar to the airline model, in which you are able to, by identifying those appointments at risk, you're able to simply overbook them. Therefore, you're able to get the most value out of your schedule time, which also helps to maximizing your machinery utilization. This is the first example we wanted to show you. And this is not limited to the no-shows. It can be applied to other to other data natures within your contact center or healthcare business. So moving forward, we could go to other interesting examples. And in here, we're going to talk a little bit about NLP in one portion, but also image recognition algorithms and ways in which how these techniques can save you dollars on both labor and overhead expenses. So moving forward, we first have the NLP. If we can move forward to the following slide. Perfect. So our first and very simple use case is, and the first thing, sorry, we can say is that NLP is an effective tool to gain insight from raw textual patient feedback or raw textual data, which I'm pretty sure some of you already have, right? From surveys or other type of communication with your patients, even call transcriptions, for example. So this can be used to extract meaningful information, making it a powerful tool in processing large amounts of patient feedback and understanding, for example, patient effort, patient satisfaction, and overall patient sentiment of each interaction, right? And this could help you reduce some labor costs. For example, if you have people manually analyzing these data sets. Our second case within this one is using natural language processing to enhance or increase your radiologist output. This one here is pretty interesting. We're talking about saving radiologist time and reducing burnout, right? Because I mean, at the end of the day, this is what you're trying to, or what we're trying to achieve. And not only reducing the burnout and saving them time, but also improving the quality of patient care itself. Because there are tools out there in the market, we can tell you, capable of saving radiologists more than an hour per day on average, simply by automatically generating impressions from the dictated findings of your readings, right? And furthermore, those impressions can be customized. So even the language can be individually customized to each radiologist or even to your practice, to your particular practice. So you would be achieving, as I mentioned, reduced burnout, but mainly you wouldn't need to even change your workflow. So you wouldn't even have to change the way you currently do things. So these are just some examples of NLP, which, as I mentioned, is natural language processing. So moving forward, we have our third example from this section, which would be the usage of image recognition algorithms, because artificial intelligence, as we know it, right, continues to revolutionize various spheres of our lives, right, every day, and it has multiple applications. So, for example, using AI in the existing screening process makes obtaining results easier and more convenient. So it not only saves time for the radiologist, but it also increases the output, or it could increase the output of your imaging center. So for example, recently, a team of scientists from the MIT, which is the Massachusetts Institute of Technology. I'm pretty sure you're familiar with it. They have a laboratory of computer science and artificial intelligence, and they demonstrated or showed a deep learning algorithm that they developed together with a set of different hospitals within the Boston area. So they showed this deep learning algorithm that that is capable of predicting cancer risk using just your patient's mammograms. So what this model does is finding patterns, like very slight patterns in breast in breast tissue that indicate cancer risk, but are too subtle for the human eye to identify or to catch. So as a result, the AI can find signs of breast cancer in mammograms years earlier than the cancer even appears, and years earlier than even a trained human eye ever could. So, and of course, this is not a substitution for the expert work of our radiologists. However, this could enhance their work and potentially save lives. So this example, together with the previous NLP applications that we just mentioned a couple minutes ago, can help you run your healthcare facility more efficiently. It can help you reduce time needed to perform the studies, therefore reducing costs, because we all know that time is money. But also it can help you increase the amount of patients you can receive and you can give services to on a daily basis. So this is what we wanted to show you as some of these examples of ways in which we could implement data analytics, NLP, image recognition algorithms, and other applications of data science or within data science to increase or improve your center output.
Perfect. Thank you so much, Rafa and Will. So before we have the closing thoughts, I would really like to go over some questions and answers from the audience. So we have 3 questions for today that are related to the topic. So the first one is, how has the use of data analytics in the healthcare industry evolved over the past 10 years, let's say? And what new opportunities have emerged from improving operational outcomes as a result?
Awesome. Thanks, Denise. I'll take the first portion of that question. It's kind of a 2-part question, but from being in healthcare now for just over 20 years, especially in the radiology and medical imaging segment of healthcare, what I can tell you is that as a person who has both been a tech and been on the clinical side, and has also managed imaging centers, as well as been on the side of the table that has helped see healthcare turn the corner as it relates to digitization. Back in 2004, 2005, it was still, dark rooms and film development. That's kind of how I learned to be a tech, so don't age me. But I've also seen the world of healthcare and medical imaging turn the corner into a digital age as well around 2006, 2007. That became very prevalent. But what that meant is that there was also a learning curve. And so from that time until probably around 2012, 2013, I was still seeing, providers with handwritten records, print off records, stacks and stacks of, file folders in their office, et cetera, and really no way to systematically keep up with that data, let alone mine it and utilize it for making decisions. Since that time, we have seen the healthcare industry start to evolve into a more digitized environment, with the more prevalent use of things like EMRs, risk systems, even PAC systems, and different types of environments that allow you to digitize your data, digitize your patient medical records, and then mine that data and utilize that data for driving decisions and having a more developed data-driven and digitized culture. So, we've seen it all across the marketplace. It's still a work in progress, obviously, but it's becoming more and more prevalent. And now we are seeing the use of artificial intelligence. We're seeing the use of machine learning and different things that we are doing in the healthcare field to help with that transition and help us as a marketplace move into that digital age. So that's where people like Rafael come into play and allow us to really turn that corner and utilize that data to be more reliable in our patient care and how we make decisions around healthcare. And that's just what I've seen from a clinical standpoint. I'm sure Rafael might have some insight from more of the data side of the question.
Actually, Will, I think you covered it all. So in the interest of time, we could move forward to a following question. Yeah.
Sounds great.
Perfect. Thank you, Will.
Mhm.
Yeah, really a new field, right? So a lot of stuff still to discover for healthcare and radiology centers. So
Yes.
the next question is, what are some of the key challenges that healthcare organizations face when they are implementing data analytics and solutions and this type of solutions, and how can this be overcome to ensure successful results?
Got it. I think I can take this one. So in our experience, what we have seen working with different healthcare organizations is mainly the adoption. That's the main challenge for most of the new technologies that are already available out there in the market. However, a lot of organizations are afraid to change the way they do things, and people within those organizations trying to push these initiatives, push these technologies forward, they receive a lot of a lot of pushback from their organization. So I would say adoption is the main challenge, and in order to overcome it, I would say you could invest, as we were explaining previously, in having more data literacy throughout your organization. And the moment you help your organization become a data-driven company, a data-driven imaging center, a data-driven healthcare center, the moment your people starts realizing that there's a lot of things out there in the market that can be implemented to enhance your output and to work more efficiently and to have less hours of work, which is ultimately what everyone is looking for.
Perfect. Thank you, Rafa. That was very insightful. And finally, we have a question that is related to the no-show predictive model that you spoke about a little bit about. What has been the financial, operational, and overall impact of the machine learning no-show predictive model that you have implemented in the past for some of your partners?
That's actually a great question. So from the get-go, it is very important to note that we've seen up to 15% increase in revenue, just because we have been, and it's not necessarily going to be your case. That will depend on what your no-show rate looks like right now, or after, right before implementing these type of solutions. Because we have seen imaging centers, radiology groups with up to 40% no-show rates. Well, both no-show and same-day cancellation rates, both combined. So when you have an environment such as this one, it is very easy to see top-line impacts real quick. So the return on your investment will be quick, and you will see the turnaround of your investment really fast. So we've seen up to 15% increase in your top line or your revenue after implementing this type of machine learning algorithms, particularly for no-shows. As I already mentioned, this is a pervasive issue for the healthcare industry all across.
Great. Okay, both that will be it for questions and answers. I think as a final stage of the webinar, we can just give some final thoughts. So Will, if you want to start.
Absolutely. Thanks, Denise. I think from my standpoint, I would say we have tried to supply quite a bit of information and data around making data-driven decisions. What I would say is, as a healthcare organization, and both from a clinical standpoint, from my clinical background, as well as being on the business side of the table, please do not allow the data culture to overwhelm you. It is a lot of information. There's a lot of options that are coming to the table and being made available out there in the marketplace. So making informed decisions is key and paramount to which data resources and data mining resources, data-driven decision-making resources work best for your business model and for your organization. They all probably have some benefit, but each organization, and sometimes within organizations, take a large imaging center group that's regional, that has locations all across the country. There may be different pieces of information and different pieces of data that work well for each particular region in some cases. So making those informed decisions are key and paramount. Someone like us here at CCD, we are more than happy to be a data resource for you, for helping make those informed decisions. I know Denise and our marketing team sends out information via email and via the internet and via places like LinkedIn on a regular basis. Just giving information to the marketplace, because education is key and paramount. So I would say, do your research, make sure you understand what pieces of information are important to you and your organization, and find those resources as it relates to software pieces that can help with that information. Also, you have that option of working with someone like CCD to help you turn that corner and bridge the gap between the data that's actually being stored and the repositories that you're using, and how to utilize that data effectively for your organization. So that's what we're here for, and always more than happy to help.
Thank you, Will. What about you, Rafa? Some closing?
Yeah, I would say that data science is becoming an essential tool for the radiology business, not only the radiology business, but any business really. So with the increasing amount of medical imaging data being generated, it has become crucial to have efficient, accurate methods, let's say, to analyze and interpret all this data. So I would encourage you to utilize data, and so your radiologist can improve their diagnostic accuracy, you can enhance your patient outcomes, and of course you can optimize your workflow efficiency. Those are my final thoughts.
All right, well, thank you both. As a reminder for the audience, we'll be sending out an email with the recording of the webinar in case you want to revisit it. Please make sure to look for future webinars and resources that we'll mention at ccdcare.com, or also you can follow us on social media, especially LinkedIn. Please do not hesitate to contact our sales team if you want more information on how we can partner with you and provide outsourcing consultancy services for your practice to improve back office management with analytics, appointment scheduling, and technology. So thank you so much to everyone that participated in this session. And this concludes the webinar for today. So appreciate your time and have a great day.